Cardiac arrest in children is uncommon. When it does occur, it's usually the result of another medical emergency, most often a breathing problem, trauma, or an underlying illness rather than a primary heart issue. Our first step is to assess the situation and quickly find out what's happened. Before approaching, always check to see if it's safe to do so. Look out for any dangers to yourself and the child. If anyone is nearby, such as a parent, teacher, or guardian, ask for permission. Can I help your child? If the child appears unresponsive, talk to them directly, even if they can't reply, as they still may be able to hear you. Speak calmly and clearly. Hello, my name's Keith. I'm a first aider. Can you hear me? If you know their name, use it, as this can sometimes prompt a response. If there's no response, gently tap the child's shoulder or collarbone and ask again, are you okay? Can you hear me? If there is still no response, shout for help immediately. If someone is with you, ask them to call 999 with their phone on speakerphone and leave it with you, and ask them to bring an AED if one's available. The emergency call handler will give you step-by-step instructions and will guide you through CPR if needed. If you're alone, use your phone on speakerphone and continue your assessment. Next, we need to check for normal breathing. Open the airway using the head tilt, chin lift technique. Place one hand on the forehead and 2 fingers on the bony part of the chin and gently tilt the head back. Open the mouth slightly and look for any visible obstructions. Then look, listen and feel for breathing for up to 10 seconds. Look for the rise and fall of the chest. Listen for breath sounds and feel for air movements on your cheek. If the child is not breathing normally or is only gasping, called agonal breathing, treat this as cardiac arrest. If you're alone, start CPR immediately and continue for 1 minute before going for help. This is because in children, cardiac arrest is often caused by lack of oxygen, and early CPR can restore breathing and circulation. Perform 5 initial rescue breaths to oxygenate the body by opening the airway, pinching the nose closed and breathing into their mouth until you see the chest move, which will be no longer than 1 second. Breathe just enough to make the chest rise and watch for the chest to fall before giving the next breath. Repeat this 5 times. Now begin chest compressions. Place the heel of one hand in the center of the chest on the lower half of the sternum between the nipples. Keep your arms straight and shoulders directly above your hands. Push the chest down 1/3 of its depth, roughly 4 to 5 centimeters in a small child. Compress at a rate of 100 to 120 times per minute. That's about 2 compressions per second. Allow the chest to rise fully between compressions to let the heart refill with blood. If the child is larger or you can't achieve enough depth, use 2 hands, one on top of the other. After the initial 5 breaths, continue CPR using 15 chest compressions followed by 2 rescue breaths. Maintain a steady rhythm with minimal interruptions. And finally, if there are 2 rescuers, swap roles every 2 minutes to prevent fatigue and to maintain compression quality. When an AED becomes available, switch it on immediately and follow the voice prompts. Use pediatric pads if available, 1 pad on the chest and 1 pad on the back between the shoulder blades. Where the child is under 25 kilos or about 8 years old, position the front pad slightly to the child's left side. If only adult pads are available, still use them. The AED will analyse the heart rhythm and advise if a shock is needed. When instructed to shock, stand clear, ensure no one is touching the child, and then press the shock button. And finally, immediately resume CPR after the shock, 15 compressions and 2 breaths until the AED reanalyzes or help arrives. Continue CPR until the child starts breathing normally or shows signs of life such as movement or eye opening, the emergency services arrive and take over, or you're physically unable to continue. Remember, always check for safety first. Call 999 early, if alone, after 1 minute of CPR. Give 5 initial rescue breaths before compressions. Continue 15 compressions to 2 breaths at a rate of 100 to 120 per minute. Use an AED as soon as it's available. And finally, swap rescuers every 2 minutes where possible to maintain quality.